Good morning. I am Dr. Sahil Sarin from Ludhiana. I was diagnosed with AVN in January 2023. Initially, I was taken aback by this medical condition that fell upon me. Being from the medical fraternity, I knew the probable options that I had, but despite that, I contacted probably every orthopedician in India, abroad, and sought after every possible treatment that I could get, considering a non-surgical mode, to be honest. That time I got to know about Dr. Harprasad. No doubt I got to know about him from social media and YouTube channels. And only once I was 100% convinced there is a scientific rationale behind every treatment modality that he is using, I agreed for the treatment. It is probably, as of now, the best possible treatment that you can get. Good morning. I am Dr. Sahil Sarin from Ludhiana. I was diagnosed with AVN in January 2023. Initially, I was taken aback by this medical condition that fell upon me. Being from the medical fraternity, I knew the probable options that I had, but despite that, I contacted probably every orthopedician in India, abroad, and sought after every possible treatment that I could get, considering a non-surgical mode, to be honest. I was diagnosed with grade 2 AVN. Co-decompression was the first treatment that was offered to me, but I knew the pros and cons of the surgical treatment. Even co-decompression is not a 100% guaranteed treatment option. And I knew if that fails, I would definitely land into the category of hip replacement. I'm 37 years old. I'm not too old, I suppose. And I know the durability and the longevity of the hip implants. And I knew if I rather fall for surgical replacement, I might have to need a hip replacement again in future, which is going to be even more difficult for me. At that time, I decided I'll try and seek any treatment option, provided it is evidence-based, and somehow try to maintain my joint as such. That time, I got to know about Dr. Harprasad. No doubt I got to know about him from social media and YouTube channels. But I had a thorough discussion with him for over 2 months before starting the treatment. I wanted to know about the pragmatic science behind this treatment. Dr. Harprasad shared with me various research articles worldwide. It took me over 2 months of dedicated research and study into the treatment modalities that Dr. Harprasad were providing. And only once I was 100% convinced there is a scientific rationale behind every treatment modality that he is using, I agreed for the treatment. The focused shockwave therapy, the main treatment which Dr. Harprasad is using, which he has also upgraded during the course of my treatment with the Orthotripsy machine. It is probably, as of now, the best possible treatment that you can get to not only control the AVN, but also find significant improvements over time. I have been doing regular MRIs every 3 months, though Dr. Harprasad recommended it is not necessary to get it done every 3 months. But I have been doing regular MRI every 3 months since the last 1.5 years, and my AVN has not progressed even a single bit. I was walking with a crutch for approximately 8 to 10 months, but now, over the past more than an year, I suppose, I am walking absolutely fine. My AVN has not progressed. The bone edema, which is the main factor which leads to progression of AVN, has totally disappeared. Not only the shockwave therapy, the advanced laser machines that Dr. Harprasad has, probably they are not available in entire India. A lot of similar practitioners also claim to possess these things, but I have contacted and inquired about their machines also. But the latest and the most advanced versions of all the lasers and the shockwave machines is present with Dr. Harprasad. I'm a clinician myself, and why I'm saying all those things is because I want people with my problem to reach the right place at the right time. I have been in a lot of stress over the last 1.5 years, as I told you, because it is a very heartbreaking disease, and it mostly affects people of young and middle age. And I just wish through my means this message reaches out to as many people suffering from this disease as possible. I have had tremendous improvements. AVN is usually most commonly found in both or bilaterally, both legs or bilaterally. But because I could manage to reach here in time, I could somehow salvage my other leg. And my affected leg, it is much better. There are massive improvements in both radiographically and symptomatically. I'm able to live a normal life as of now. I'm hopeful as time progresses, I might be into active sports life as well. So here is all the best wishes to Dr. Harprasad. I wish him all the best for future, and I wish that his noble and genuine efforts to treat patients with AVN reaches a much wider scale of people, probably nationwide, internationally as well. Thank you, Dr. Harprasad. Best wishes from my side.
Before after X-ray presentation of Dr. Sahil Sarin, 36 years of male, he came to us on 16th of April 2023 with a grade 3 AVN bilateral side. As you can see, this is the MRI done on 3rd Feb 2023. इसमें आप देखेंगे on the left side काफ़ी बोन एडिमा है, और देखेंगे बोन एडिमा काफ़ी है, और नेक्रोसिस जोन काफ़ी बड़ा है. ये नेक्रोसिस जोन है. क्रिसेंट साइंस है और माइल्ड सबकॉन्डल फ्लैटनिंग है, बहुत ही मामूली. बॉडी बोन के जो कंटूर है नॉर्मल है, और जॉइंट डिफ्यूजन है दोनों साइड. इसका भी जोन काफ़ी बड़ा है, 3rd स्टेज में है दोनों. और इनिशियली ही टेक सम मेडिसिन एंड ही केम टू अस ऑन 16th of April 2023. उस टाइम हम लोगों ने एक्सरे करवाया इनका, और इसमें देखेंगे आप ये नेक्रोसिस जोन है, ये क्रिसेंट साइन है, और दिस इज द नेक्रोसिस जोन. इसमें भी आप देखेंगे ये क्रिसेंट साइन है और नेक्रोसिस जोन है. काफ़ी सीवियर पेन था उस टाइम, और ही इज़ नॉट एबल टू वॉक ऑल्सो. So we have done femoral angiogenesis with the help of Orthotripsy and Robotic pulse and direct laser. On the first treatment, बोन को हम लोगों ने रिवास्कुलर किया, और विदिन 5 सिटिंग के अंदर इसका पेन मैक्सिमम डाउन हो चुका था. Then we have done a X-ray on 6th of March 2025, जो कि काफ़ी टाइम के बाद हमने एक एक्सरे करवाया, और ये लगभग 2 साल के बाद. अब देखेंगे बोन जितना टाइम बीता उतना बोन अच्छा होते गया. बोन में कहीं कुछ लॉस नहीं हुआ है 2 साल ट्रीटमेंट के बाद भी, और बेहतरीन रिजल्ट. अभी इसका कोई साइन सिम्टम्स नहीं है, ना तो कोई MRI में भी काफ़ी इसका डिटेक्ट नहीं हुआ रिसेंटली. और बोन के कंटूर आप देखेंगे बिल्कुल नॉर्मल कंटूर है, कहीं सबकॉन्डल लॉस नहीं है, और नेक्रोसिस जोन कहीं भी नहीं दिख रहा है. इसमें बिल्कुल नॉर्मल है, बिल्कुल बोन. इसमें आप देखेंगे नॉर्मल बोन के कंटूर है, कोई नेक्रोसिस जोन दिख नहीं रहा है, और पेन बिल्कुल ना के बराबर है. इनको पेन होते नहीं है यूजुअली, और सब काम ये करते हैं. तो गाइज, अगर आप लोगों को एवियन है तो इन दैट कंडीशन आपको घबराने की ज़रूरत नहीं है. जितना क्विक आप करा पाएंगे उतना बेहतरीन रिजल्ट हम लोग दे पाएंगे. ये जो डॉक्टर और ये ऑर्थोडेंटिस्ट है, इनके भाई भी ऑर्थोपेडिक सर्जन है पंजाब में, और वो खुद ने रेकमेंड किया था इसको, तो इनको बहुत बेहतरीन रिजल्ट हमने दे पाया और सर्जरी से बचा पाया। थैंक यू। AVN इज curable.
AVN hip joint treatment without any medicine or operation. Why replace when we can repair, regenerate and regrow? By renowned Dr. Harprasad, MPT Ortho, MIEP laser specialist, USA and Germany at Advanced Global Health Spine Joint and Laser Center.